Hello, I'm Michael Cabanargi, Regional Director of the U.S. Department of Health and Human Services for Region 5, which covers Michigan, Ohio, Indiana, Illinois, Minnesota, and Wisconsin, and 34 sovereign tribes. At HHS, we understand that Americans pay too much for prescription drugs, especially our seniors. I've heard heart-wrenching stories of seniors across the Midwest who've had to cut their pills in half to make them last, or foregone filling a prescription altogether because it was too expensive. That's unacceptable. But the Biden-Harris administration is taking a stand against sky-high drug pricing, and finally, seniors are starting to see results. In 2022, Congress, with Vice President Harris casting the deciding vote, passed the Inflation Reduction Act, a landmark piece of legislation that is transforming how people with Medicare access and afford prescription drugs. Thanks to this law, people with Medicare coverage now benefit from a $35 monthly cap on covered insulin, and they can get recommended vaccines like shingles and RSV for free. And most recently, Medicare has successfully negotiated lower prices for 10 of the most expensive and most commonly used drugs by people with Medicare. This is truly historic. We fought to make this policy a reality for decades. But that's not all. A major new benefit will be taking effect soon. Starting in January, all Medicare Part D enrollees will now benefit from a flat $2,000 annual cap on out-of-pocket drug costs. This could mean thousands of dollars in savings for those of you who rely on high-cost medications, and it means peace of mind for millions more who no longer have to worry that they are one future diagnosis or prescription away from bankrupting themselves or their families. As HHS Regional Director for the Midwest, I'm proud of what our administration has done for our hardworking families who deserve to live and age with dignity. To learn more about how you and your family may benefit from this law, visit lowerdrugcosts.gov. Thank you.
Produced by the U.S. Department of Health and Human Services.